An autism diagnosis is very subjective, meaning there's no blood test that we can do right now to say your child has autism or not. So many of the things we look for to diagnose autism are actually observable behaviors, and there's two main categories for that. Children with autism have delays or impairments in communication and social interaction, and they have restrictive patterns of behavior. What this means and ways you can identify if your child fits into these categories are things like your child isn't babbling as much as other children in the playgroups you're in, or your child doesn't do things like pointing to things and showing you things. Those are signs that your child has a developmental delay in communication. Often children with autism play by themselves and aren't as interactive with other individuals as typical children. And that could be a sign to you as well that there's something a little bit askew here in how your child's interacting with the environment. When it comes to restrictive and repetitive patterns of behavior, those things can be really limiting and important because how most of us learn in the environment is by looking around and seeing what's happening, exposing ourselves to new experiences. Often children with autism become quite isolated in their patterns of behavior, meaning they like very routinized things. For example, toast presented the same way every day, cut the same way, the same brand. They don't like to deviate in the car to different pathways to get to the playground. They like to go the same way all the time. So they're limiting their exposure to the environment. Some other early signs of autism are a lack of typical gestures. For example, many children will lift their arms up when they want mom and dad to pick them up, and that might not be happening by your child. Another simple thing to look for is, does your child listen when their name is called? As a parent with a child with autism, you know best your child. And very common when you go to your pediatrician with concerns about your child's development, unfortunately, you will be told that it's just because they're two, they're going to grow out of it, things are fine. Well, you can diagnose autism as young as 12 months of age. There are lots of screening tools online for you to be able to assess yourself, your child's development and risk for autism, such as the MCHAT. So as a parent, if there's something in your gut saying there's something wrong with my child, continue to advocate, get a second opinion, and make sure that you're exhausting all of the options available to you to get the supports and services you need for your child as soon as possible. Early intervention is critical in this journey. The earlier you get your child diagnosed, the earlier you can get them access to services, and that has a dramatic impact on your child's outcomes.